How's it going, guys? It's 2:53 a.m. June 1st here in Japan. We have a medium difficulty question for Path Immuno Step 1 Internal Medicine 2CK. Before we get started, please subscribe to my channel. I really appreciate it. Give it a like. Really appreciate it. Find me on Instagram, mehlman_medical, mehlman_medical, links down below. Find me on Telegram. We have a new Telegram group, okay? So lots of drama. I want to keep the focus of this clip on the content, on the actual MCQ here. But if you haven't heard already, there's a new Telegram group, and you can check on my tab on the YouTube, the live videos. I've talked about why there's a new Telegram group, etc. Let's just hop into the clip here. So 38-year-old man, 4-month history of dry cough, intermittent fever. He's had a 15-pound weight loss during this time. 1 month ago, he was treated for anterior uveitis. Physical exam shows reduced tone reflexes, increased muscle tone. Laboratory studies show AST 120, ALP 220. They're both elevated. So AST should be under 50, ALP should be 50 to 150. I know you'd have the lab values available to you on the exam, but that's the point, that they're both elevated. Pulmonary biopsy is shown below. Now, if you're reading the question so far, I have no idea what's going on. The fact that this is a pulmonary biopsy, okay, that's going to give it away to some of you watching this. Okay, so which of the following is most likely to be seen in this patient? And I'll talk about this histo as we move through the question here. So choice A, decreased carboxylation, wrong fucking answer. Could refer to the effects of warfarin, okay? So warfarin is going to inhibit vitamin K epoxide reductase, decreased active vitamin K. Vitamin K, in turn, if we have less of it, or if we have vitamin K deficiency, just in general, like in a neonate, then we would have decreased activity of gamma-glutamyl carboxylase, obviously carboxylation, and activation of clotting factors 2, 7, 9, 10, anti-clotting protein CNS. Wrong fucking answer. Choice B. And real quick, I mean, pass fail step 1 now, but B7 biotin is a cofactor for carboxylation enzymes such as pyruvate carboxylase, acetyl-CoA carboxylase, propionyl-CoA carboxylase. As I already said, wrong fucking answer. Choice B, decreased glucuronosyl transferase. Wrong fucking answer. Okay, so this would be for a fucking bug on my fucking screen right now. And that just fucked up my clip. But you know what I'm not going to do? I'm not going to restart the whole fucking clip. We're going to keep this candid, aren't we? So decreased glucuronosyl transferase activity would refer to Gilbert syndrome, or Gilbert, okay? So spelled Gilbert, and that's going to be an unconjugated hyperbilirubinemia in an otherwise young, healthy adult, usually following stress. Okay, very buzzy presentation as a med student, stress for exams, gets mild scleral icterus, just yellowing of the eyes, and you just see unconjugated bilirubins increase. You don't have to treat it. And they might say there were a few episodes in the past. And 2CK level version of this question is they'll give you a patient who just had surgery 2 weeks ago, and there's an unconjugated hyperbilirubinemia, and you eliminate the other answers to get there, and you just say, well, it's Gilbert from the stress of surgery. Okay? Wrong fucking answer. Choice C, decreased IL-12 activity, wrong fucking answer. And we know it's wrong because this image here is showing us non-caseating granulomas of sarcoidosis. And granulomas are histiocytes, which are activated macrophages that will congregate, coalesce, and form multinucleated collection known as a granuloma. Okay, so granulomas interact, so the histiocytes, the activated macrophages, interact with CD4 Th1 T cells. So you've got the macrophages secreting IL-12, so IL-12 would theoretically be increased here. Macrophages secrete IL-12, that'll activate the Th1 cells to secrete IFN gamma, which in turn will stimulate the histiocytes more, and we get a circle. Okay, I talked about it in my Immuno PDF. Step 1's pass-fail, not dramatic. Point is, wrong fucking answer. Choice D, decreased renal absorption of phosphate. Wrong fucking answer. A bit challenging. Okay, so in sarcoidosis, we are going to have choice E, increased hydroxylase activity. Correct answer. So you need to know that the activated macrophages and the non-caseating granulomas in the lungs, they can exist elsewhere in the body, like the parotid glands, etc., but in the kidneys as well. But the lungs, okay, so non-caseating granulomas, the activated macrophages, the histiocytes, they're going to secrete 1-alpha hydroxylase, which is going to convert inactive 25D3 into active 125D3. The latter goes to the small bowel, causes absorption of calcium. Then if we have high hypercalcemia, you need to know that, very high yield. So hypercalcemia, it's going to suppress negative feedback. The calcium sensing receptors, parathyroid glands, PTH goes down. They love that for USMLE, okay? They give you a sarcoidosis question, and you just need to know it's an up arrow for 125D3, down arrow for PTH, because PTH is suppressed. Well, what does PTH do at the kidney? It does three things. So number one, it causes the reabsorption of calcium in the late DCT. Number two, it's going to cause decreased phosphate reabsorption in the PCT. It's a little bit confusing. It downregulates three different types of apical phosphate symporters. Okay, so those symporters are there reabsorbing phosphate, downregulates them, meaning we get increased phosphate excretion. So you just say PTH is causing increased retention of calcium, and we're flushing out phosphate. And so we're not going to be able to do that. We're going to do less of that. We're going to have more absorption, more reabsorption of phosphate if PTH is lower in the PCT. It's a little bit difficult. Third thing PTH does in the kidney is activates 1-alpha hydroxylase. So we would have decreased renal 1-alpha hydroxylase activity here, but increased pulmonary hydroxylase activity. That's what you need to know, okay? Now, this answer, increased hydroxylase activity for the 1-alpha hydroxylase secreted by the non-casing granulomas, this will be an answer on USMLE. They love this, okay? So hypervitaminosis D can be caused by sarcoidosis. You know the deal. Make sure you make more content. If you like my stuff, subscribe my channel. Appreciate your time. That's it.